Hello guys, am I clearly audible and visible to you? Let me know in the chat box. I'm waiting for your answers in the chat box. Let me know in the chat box once. Am I clearly audible and visible? Good evening, good evening. As exam is so near, right? So we are just going to talk about the important things only, right? Whatever the important related to the radiology, we are going to cover up in this session. Mostly we are covering with the MCQs and some basics which are frequently asked in the previous years, right? So we are not going to waste the time. We are going to highlight all the things. Also, the radiology subject, please understand this thing. The radiology subject will going to help you in the orthopedics. Like they can give you the X-ray of a fracture and they can ask you the type of fracture or maybe the bone which is fractured. Anatomical, they can ask you. Although they can ask you some surgical like USG report they given to you. So these things are possible to be given from the radiology. Okay. So don't wasting the time. I'm not wasting your time, and we're going to start. Just let me know in the chat box, guys, who guys are watching live. Just give me the thumbs up in the live chat box so I can start the session. Uh, if audio video is fine, right? From my end, it is totally fine. As I can see on my screen, it is totally good, right? Audio and video is good. But I need the response from you guys, right? Perfect, right? Everything is perfect. Let's start. Let's start. So I'm starting with the first some important images, which is the radiological images are frequently asked in the FMGE and NEET PG exam. So I'm starting with the first one, and you can see on your screens there is a very good image, the X-ray image, right? The erect abdominal X-ray is given to you, and this is the neonatal X-ray, right? Please remember about it. This is the neonatal child X-ray is given to you. Now, what you can see on this screen that there is a neonate, which is a newborn, and also you can see over here, this is a highlighted the things that there is a something air filled is inside the chest cavity. Okay, so there is a something which is inside the chest cavity, and although by seeing it you can identify that what is the most common, guys. Also you can see over there that there is some intestinal things, right? It seems like that some intestinal things is there, and how the intestine can cross your abdominal cavity to your thorax cavity, right? It is not possible, but yes, it is possible, and we are confirming this is by the inserting the nasogastric tube, right? We are also trying to this about the nasogastric tube. And guys, what happened, there is a diaphragm, right? There is a diaphragm which is going to separate your thorax and the abdominal cavity. You know very well that this is the thorax and this will be your abdominal cavity. Yes, and this is the separation. The separation is done by, yes, the separation is possible done by the separation is only the possible done by your diaphragm. Now, if there is a congenitally, as I told you, this is the neonate, as it is the your neonate. So what can be happen? There is a congenitally, there is a diaphragmatic hernia, right? So there is a diaphragm is there, where there is a herniated, or we can say the weakened, and due to this, right? Due to this, from there your intestine can move to your thoracic cavity, right? So I'm erasing again all the things so it's clearly visible to you guys. Right now you guys can see over here. If this image is given to you, what will be your answer should be here? Your answer should be your congenital diaphragmatic hernia. Okay, so please remember about this image. They asked you twice and thrice they asked you this particular image from this, right, from the congenital diaphragmatic hernia. Moving forward for the next image. Now the next image is given to you, you can see over there, right, and this is a very special sign, right, and this sign is known as also the football sign. Okay, this sign is known as also the football sign. Now also, you can see over here, like this is also the again the X-ray image, which is a supine X-ray image from the abdominal cavity, and the thorax is also there, right? And you can see over there that the diaphragm is pushed upwards, right? The diaphragm is pushed upwards, and there is, you can see, the abdominal walls are totally extended. Okay, and now you can think over here that as it is stretched over here, now there is a what can be the possibility as it is pushed upwards also. So this is the your diagnosis, which is the football sign, is the classically seen in the your guys pneumoperitoneum. Pneumo, it means the air. Peritoneum is the peritoneal layer of the abdomen, right? So there is a air is trapped in the your peritoneal cavity, and this is known as football sign, right? It seems like a football. Okay, it seems like on the X-ray you can see over there, like it seems as a football. So this is known as your football sign, right? Moving forward for the next one. Now the next is your from the coarctation of aorta, which is also known as your figure of 3. And what is a figure of 3 is here, you can see over here, as the aorta is exiting from the heart, it is giving a figure of 3. This is your figure of 3. Okay, and not only this figure of 3 is seen in the coarctation aorta, also inferior rib notching. You can see over here the rib inferiorly, the ribs are getting notched, right? There is a notch is seen over there. So inferior rib notching is also is the classical picture of your coarctation of aorta. Okay, inferior rib notching is the classical sign of your coarctation of aorta, right? Now, so please remember about it. If you can see over here, this is the heart, and please remember from this aorta is exiting like this. Okay, so on the aorta, if we are seeing the figure of 3, right, as we mentioned over here, so this is known as your figure of 3 sign. Okay, this is known as the figure of 3 sign, which is seen in the classically seen in the your coarctation of aorta. Coarctation of aorta. Now, moving next. The next is seen here, right? What you guys can see identifying here. This is also the picture of a child, which is seen to you, and you can see over here the heart is here. The heart shadow, which is seen over the X-ray, guys. This is the shadow of the heart. It seems as a boot shaped. Now you can see over here. This is right. So now, as you can see, the on the X-ray there is a shadow of heart, right? The shadow of heart is seen as a boot-shaped heart, right? So this boot-shaped heart is classically seen to you in the tetralogy of Fallot. I hope in the pediatrics you studied this tetralogy of Fallot well, but please remember the image of it. Okay, classical image of it, which is the boot-shaped, right? Which is the more frequently question asked in the your FMGE exam. So maybe they can ask you this time also regarding this tetralogy of Fallot, and which is your boot-shaped heart. Now, moving forward, this is from the your picture of a patient, and this classical picture is coming from the your ENT subjects. And what is this? This is the known as your thumb sign. It is feel like that there is a thumb is over in the scene. The thumb is given to you on the near the your jaw, and this thumb sign is seen in the classically seen in your acute epiglottitis. Guys, please remember in the acute epiglottitis there is a shadow of this glottis will be given to you as a thumb. So this is seen in the your acute epiglottitis, the thumb sign. Please remember about it from the ENT. I hope you saw this. So again I'm erasing it and showing you this arrow mark is showing you there is a thumb like structure. Okay, so if this thumb-like structure is seen to you, that means is your acute epiglottitis. This is the diagnosis, making the diagnosis of your acute epiglottitis. Acute epiglottitis. Moving forward, the next we are moving forward for the next, which is the for, again from the your abdominal. And what is this, guys? Please remember about it. There is a three bubble type of the sign. One is the single bubble sign. The second is your double bubble sign, and the third is your triple bubble sign, right? So they are sometimes they are giving you this bubble signs and try to make you confused, right? So don't be confused and just see this thing and try to understand this thing. Okay, now you can see over there, like from the mouth and esophagus, the things are going to pass through it, and then the structure will be going to attach with your stomach. After the stomach, there will be the duodenum and duodenum, ileum. This will be going to in a pathway of the small intestine. Now, if the air is shown just as a single bubble in the abdominal X-ray, if just the air is seen as just a single bubble, that means now where will be the your abnormality will be there. Please understand this part. As the air is coming from the above, it will become into the abdomen, and it there will be the your congenitally your hypertrophic pyloric stenosis. So the pyloric part of the your stomach, which is the last part, right? There is a stenosis will be there, and short form is known as CHPS. So now, if there is obstruction at the stomach lower part, so this air is trapped in the your stomach only. So this is the stomach of the child, and there is a trapped air only. So please remember about it. The single bubble sign. The single bubble sign will be seen in the your pyloric stenosis. The single bubble sign will be seen in your. Sir, why bubble is formed? Please understand this part. Why bubble will be going to form? If there, we are talking about what? We are talking about the your X-ray. On the X-ray, what is the scene? Please understand this part. The air is seen in the your black color, and the tissues are whitish, right? So now what can be happen? Doctor, there is a like if I'm breathing over here, so air also can be passed little bit right over there. So sometimes when we are doing the X-ray, we can see the intestinal air is also there, right? The normally we are seeing over there, like gas formation, right? Under diaphragm, we can see the gas. Okay, under the diaphragm, gas is seen as the normally, right? I can show you in the next. I will show you the X-rays, right? So this bubble is formed that the air is not just trapped over there, not passing over it. Okay, now if I'm talking about the second one, you can see over here, right? Now if I'm talking about here, like why the double bubble sign? What is a double bubble sign? You can see over there, like from the esophagus, the air is coming to here, and it is giving you the first bubble of your stomach, right? And it is passing through into the duodenum. But now from the duodenal, now please understand it. Now in the duodenal, the descending part of the duodenum or the second part of the duodenum is getting obstruction. Okay, now it is getting obstruction. So now what can be happen? So now there is the air will be not going to pass through further. Right now it cannot move more further. So now what can be happen? There will be the your there will be the two bubbles will be going to see. The first bubble is made by from the stomach. The second bubble, which you can see over here, it is by the duodenum. It is by the your duodenum. So there is a two bubbles will be going to seen continuously in the abdominal cavity. It means the stomach is passing this air. The next it is by the duodenum, and the later it is not moving forward because the duodenum is obstructed, and this is the making diagnosis the duodenal atresia. right? It means the duodenum is getting atresia. There is a congenital abnormality, which is the duodenal atresia. Okay, guys. Now, good to go. Now, so the single bubble is a chronic pyloric congenital pyloric stenosis, right? And the double bubble will be going to seen in your duodenal atresia, duodenal atresia. Now, the third, which is as I told you, there is a triple bubble sign. So now there is a three bubbles will be going to seen. Again, same the direction from the esophagus. The first air will be going to pass through your stomach. Just a minute. Through the stomach. So the first will be here seen to you. The first bubble is from the stomach. The second will be going to made by your duodenum. And as the duodenum is attached with the jejunum, so there is a third bubble will be going to seen by the jejunum. Now the obstruction is at the jejunum, right? Now the obstruction at the jejunum. So now what we guys can see over there, the first bubble from the stomach, the second for the duodenum, and now the third is from the jejunum. Now the jejunum is not passing this air more further, so there is a cause. It means that the jejunal is getting blocked. So the cause of it is the jejunal atresia. So the cause of it is your jejunal atresia. So please remember it by the just easy format. Just remember about it. The single bubble, it means the issue at the stomach. So that's why what we made about this the mnemonic for understanding it. So there is the chronic pyloric stenosis because the bubble is only the single. So the first structure will be going to involve. It means the first structure is what your the first is your stomach pyloric stenosis. The second, if there is a two bubble is seen to your, the second structure will be getting involved. After the stomach, what we have? We have the duodenum, right? So there is a duodenal atresia. If there is a three bubble is going to seen, so there will be the totally three will be going to seen over there. What is the mean of this three? What is the mean of this three? There is a stomach, duodenum, and jejunum, right? Duodenum and jejunum. So there is a triple bubble sign will be going to seen in this case, right? I hope it is easy to you remember and easy to see also. Okay. Now you can identify by the seeing these images of radiological X-ray images, the single bubble sign, double bubble, and the triple bubble also, right? I hope it's now easy. Okay, let's move forward. The next, the next you can see over there, this is the barium swallow. Okay, or what we are doing in this condition, we are giving the patient the barium, and as the patient is drinking this barium, after drinking this barium, there will be we are taking the x-ray of this patient. So you can see over there as the patient has had this barium over there, so this barium should be go downwards through the esophagus, but there is a abnormal thing which is seen over here. That's a there is a esophagus. Before the esophagus, starting this esophagus, we can see this outpouching over there, and this outpouching is known as your Jenker's diverticulum. What it is known as? It is known as your Jenker's diverticulum. So we can see here, we can see the barium drink also we can see, right? It means we just given in a uh, we just given in the form of liquid, right? We are giving the barium in the liquid, right? And barium swallow, right? So the this is the barium X-ray. So we can say the barium drinking also we can say, right? So the barium X-ray, on the barium X-ray there is a, if outpouching is there, so you can see this outpouching is filled with this barium, so it's visible to us, and we can see this particular outpouching which is your Jenker's diverticulum, which is your Jenker's diverticulum. Now moving forward for the next image, which is again from the barium swallow, right? Guys, please remember about it. If you are giving the barium from the above in the GI imaging, if I'm giving the barium from the above, it means from the mouth, right? That is the barium swallow, okay? And if we are giving from the rectum, that is known as barium anemia. right? Barium anima. So this is also the, again the classical picture of your barium swallow. And what you guys can see over here, what you guys can see over here in this particular thing, that there is a barium swallow. You can see over there the esophagus is totally big, but at the end of it, where it is going to attach with your stomach, this is getting narrowed, right? This is getting narrowed. As it is going to getting narrowed, so you can identify it, right? You can see over here what you can see over here, that it is getting from here, and in the lower part of your esophagus, it is getting narrowed. As it is getting narrowed, so what we can see over here, right? It is, seems like that there is a bird beak appearance, right? If I'm going to show you, if I'm just rotate this image, so it just seems like that there is a bird which is having the beak appearance. So this is a beak of bird, right? This is the beak of bird, and this particular seen in the barium swallow, this particularly known as the barium beak appearance, or we can say the bird beak appearance. And particularly, guys, please remember about this, that this bird beak appearance is seen in the condition of achalasia cardia. I hope you know about this achalasia cardia. You studied well in the surgeries, so please remember about it. This is the frequently asked in the your FMG exam, that bird beak appearance seen in achalasia cardia or esophagus cancer. So I'm going to identifying you now here only, that how this bird beak appearance and how this your red tail appearance. So please remember about it. For the achalasia cardia, there is a bird beak appearance. Okay, so there is a achalasia cardia is the bird beak appearance. Bird beak appearance. Now the next, the same you can see over here. First, as I show you what is a bird beak appearance. This is a totally your broad esophagus, and it is getting, suddenly it is getting narrowed at the end, right? It is getting narrowed at the end. Now just check out the next image. You can see over here, this is the esophagus, and after this esophagus, now the esophagus is irregularly narrow and dilated, right? Little bit narrowed or also, and dilated also for long. And this is, seems like that there is a rat. This is the body of the rat, right? You can see over here, this is the mouth of the rat, right? This is the body of the rat, right? And this is the particularly we can see over here, this is the tail of rat. Okay, this is a tail, right? So this is the particular image, which is the barium swallow image, is known as, the particular sign is known as red tail appearance. This the particularly is known as your red tail appearance. And now this is red tail appearance. Please understand this, both of the images are totally different. The achalasia cardia is different, and the red tail is the different. Okay, so the red tail is seen in the, particularly seen in the your esophageal carcinoma, the cancer of the esophagus. There will be seen in the cancer of esophagus. But if I'm talking about the achalasia cardia is seen in your condition of your bird beak appearance is seen in your achalasia cardia. Just compare with this. You can see over there, this is the, suddenly there is a broad esophagus and just getting narrowed at the end of it. Okay, at the end of it. And if I'm talking about this esophageal cancer, which is the red tail appearance, you guys can see over there that there is a narrowing will be going to start it, and then it's irregular narrowing, guys. It is not the regular, it is an irregular narrowing, which is, seems like the red tail appearance. So bird beak appearance, achalasia cardia, red tail appearance, esophageal carcinoma. Don't be confused and don't mark answer in hurry. Okay, just think about it, see twice, and then mark the answer, that is it the achalasia cardia, or is it the your it is the your esophageal cancer. Okay, guys, so this is the two which is making sometimes confusing. And the most of the time the in the FMGE exam and the NEET PG exam, they are asking about the achalasia cardia frequently, right? But last 1 year ago, they asked about the red tail appearance, and all the students are marked your achalasia cardia, right? Esophageal, and they asked about the red tail appearance, and the student marked the ecclesia cardio. That was the wrong answer, right? So please remember about it. Now we are moving forward for the next, which is the CT scan, which is a CT image. And in the CT, I can see over here, like this is the CT of the thorax region, and in this particular image, what I can see over here, this is the your vertebra, right? And this is the your sternum, and this is the your all the medial sternum structures which you can see over here, right? This all are the your medial sternum structures which are seen over here. Now in this condition, you can see over there just in front of your vertebra, just in front of your vertebra, we can see here this is the aorta. This one is the your aorta, and as you can see the aorta, it's passing the blood is passing through this aorta, right? But I can see over there is a sign scenes like this in this aorta. And now it is seems like that. I hope you guys are played with the your tennis ball. So there is a green color ball is there, tennis ball, and there is green or red, right? So there is a strap of white color strap is passing through between this ball, right? So the same appearance, just I'm removing it, so you can see over here the same appearance you can see over the your CT thorax, right? CT thorax, and you can see over there is a crescent shape, right? This crescent shape cut will be seen, or you can say the tennis ball appearance will be going to seen on the aorta, and this is the particularly this tennis ball sign is seen in the your aortic dissection. This particularly image will be getting in the this particularly sign will be getting in the your aortic dissection. Okay, so this is seen in their aortic dissection. Now, okay, guys. So moving forward, this tennis ball is completed. Moving forward for the next one, this next is you're known as dripping lily sign. Okay. Now, what we are seeing in the dripping lily sign, you guys can see over here, we are just injecting the in the vein we are injecting the dye which is can filter through this your kidneys, and after the filtration we can see over this urinary system. For the taking the examination of urinary system, we are taking this images, right? So you can see over here. Now you can see over here, we can see on this side that this is the drooping lily, right? So the flower is like there, right? Lily flowers, right? So this is known as the drooping lily sign, and this particularly drooping lily sign will be seen in the duplication of urinary calycal system. So you can see, or you can compare over here from the right and the left side, you can compare. On the right side you can see there is the duplication, right? What can be happened, there is a duplication of the urinary calcary system, and this is particularly seen in the your this particularly known as your dripping lily sign. Guys, what about this air filled things are here? Yes, this is the intestine. Okay, this is the intestine. Okay, as earlier you was asking, sir, how this bubble is there seen. Okay, doctor, so this is the air which is the trapped over there, right? So you can see this air in the on the x-ray, right, in the intestines also, right? Now there's the no bubble is seen to you because air can pass through it. Okay, now so this is your dripping lily sign, dripping lily sign. Moving forward, the next, which is the known as your raindrop sign of a skull. This is the known as your raindrop sign of the skull. As you can see over there on the skulls, we can see over there this is a raindrop, or we can see the punch out lesion also. Punch out lesion. Okay, how this punch out lesion? It means it seems like that there is a punched out lesions are seen on this one, and this classical punched out lesion, or it seems like some raindrops are over the skull, right? So this raindrop and the your punched out lesion is classically seen in the your disease of multiple myeloma. All right, so there is a classically seen on the your multiple myeloma, right? So this is the image of multiple myeloma. So they are asking you the punch out lesion or the raindrop sign are seen in. So this is seen in the your. This is the scene in the your, yes, multiple myeloma. Multiple myeloma. Now moving forward, the next image you guys can see over here that on the skull it seems like that there is the hair growth or the skull, or it seems that on the x-ray the x-rays captured the hairs, but it is not possible, guys, right, that hairs are visible over the x-rays, but it seems, right? And this in particular sign is known as, this particular sign is known as your hair. This particularly sign is known as your hair on end appearance. Hair on end appearance. It means it seems the hairs will be on the end of the skull. And how it will be going to seen, in which a disease we can see this hair on the skull or hair on end appearance. This particularly seems in the your disease of thalassemia, right? So this will be going to seen in the disease of thalassemia, right? The patient will be going to seen on the hair on end appearance will be in the thalassemia, right? Now moving forward for the next image, right? So from the skull, please remember about these two images, raindrop and punched out lesion. They can ask you with the both of the name. We can say, right, raindrop or the punch out lesion, or we can say the hair on and appearance, right? Guys, if you know about this images, please try to reply me in the chat box so I can understand like how you guys are prepared or not. Well, right? So try to reply as I show you the image. Please try to reply me in the chat box, right? Please try to reply. If you are answering correct, it is also good. If you make mistake, you can make mistakes here, right? Don't mistake in the exam, right? I will going to correct your mistakes here only, right? So just I'm showing you the image and please try to reply me in the next image. So this is the image. Now you can see over here. Tell me the which sign is seen over here in this lungs abscess image. What you guys can see over here in the lung abscess. As you can see, guys, here the lungs is totally filled with the air. So this is the blackening will be seen a little bit, and this white little bit will be their tissues, which is the lungs, right? It will be give the image of lungs. But I can see over here there is a whitish ball like appearances over there, and also we have over black marking is there wrong, right? And this is known as your, again this is also known as your crescent sign, right? This is also known as your crescent sign, and this is classically seen in your image of lung abscess, right? In the lungs abscess, yes, yes, doctor, right? So if there is a lung abscess, there will be the crescent sign will be seen on the your chest X-ray, chest X-ray. Okay, next, very important, very frequently asked in from your ENT subject, right? And you know very well, which is known as your steeple sign, or we can say the pencil tip sign, right? We can say the steeple sign, we can say the pencil tip sign. And what is the meaning of steeples? I hope you saw the uh, church or any other historical places. So what they are having this like building ants with the some steeples, right? So the same, or we can say the pencil tip sign also. Just I'm marking with it so you guys can understand over it. So this trachea, it seems at the narrowing from the above, making a steeple over here, or it can be see the pencil tip, right? So how we have the pencil? We have the pencil like this, and we have this narrowing at the above on the tip, right? So this is known as the, this will be particularly seen in the your croup, which is also known as your acute tracheobronchitis, right? So this is also known as a croup. So you can answer the croup also if option is given as the croup, or you can understand. Yes, you can reply as the, or you can answer as the your acute laryngo. Yes, you can answer as the acute laryngo tracheal. Very good, right? Yes, it is seen in the aspergillus. Yes, aspergillus is making this a lung abscess. Sure. Very good. Right. So this acute laryngotracheal bronchitis, there will be the steeple sign will be going to see, or you can see over, you can say the steeple sign also. You can say the steeple sign also. Now, the next one, which is the your obs and gynae image from the ultrasound, and this is the ultrasound image of ovary. Right, this is the ultrasound image of the ovary, and what I can see on this particularly ultrasound of ovary, that on the ovary there is a follicles are there, and this follicles are now getting mature. Okay, and the multiple are enlarged, and this enlarged your follicles are arranged on the periphery. Okay, this is arranged in the periphery, and this is giving me the appearance of necklace of pearl appearance. What image it is giving me is the necklace of pearls. Now, just a minute, I will compare you the ovary hyperstimulation syndrome. Classical picture is also seen over there. Don't be confused with the ovary hyperstimulation and the next, which is the your PCOD. Okay, both are totally seems different. Okay, just I'm showing you, this is the necklace of pearl on the PCOD. Just the next image which I'm inserting here. Now you guys can see over here, is it in the periphery? Is it seems in the periphery, or it is just only in the periphery? No, it, what I can see over here, what I can see over here, this is the hyperstimulated, very big follicles are over there, right? And they are not on the periphery, they are covering whole this. So these are the ovarian hyperstimulation syndrome. This is known as their OSH, which is the ovarian hyperstimulation syndrome. So you have to remember this both of images. They can ask you, the necklace of pearl appearance is seen is in the PCOD. Okay. Now, in the PCOD, it will be seen in the necklace appearance. And if I'm going to talk about the ovarian hyperstimulation syndrome, right? And mostly this ovarian hyperstimulation, when we are going, guys, we are going to see this ovarian hyperstimulation in the treatment of infertility, right? In the treatment of infertility, the patient is given the hormones, and due to this, they are stimulating this ovary, right? In the cases of, yes, in the cases of infertility, this the drugs are given to the patient for the stimulating this ovary, and that's why there is a hyperstimulation. There is a, due to this drugs, there is a hyperstimulation of ovary. This follicles are getting very bigger, so this will be going to see. So the ovarian hyperstimulation syndrome, there will be the all around there is a big follicles will be going to see. In this we can see, in this we can see there is a, in the PCOD we just can see over there, we can see only over there, there's a necklace of pearl appearance. It means the pearl, the round pearls are seen on the border of the ovary, right? Now, moving forward, now guys, we are starting with the some MCQ based session. Important images we covered over there. Now it's time to you, I'm going to show you the image over the screen, and you guys have to answer over it. Okay, I'm waiting for your answer, guys. Please try to reply as soon as possible. Okay, so we can go for it. Now the question is in front of you on your screens, so you can answer in the chat box, right? The question is given to you: the newborn with the continuous producing saliva, the intern was on the duty to pass the NG tube and got the X-ray done revealed the following picture. They are asking you the condition, right? Now, by the seeing this image, just if you want to do, I can do the zoom in of this image. Just a minute. You can see. I hope now it is clearly visible to you. Just check out the image. Just check out the image and then try to answer it. Then try to answer it. That what you guys can see over here, that this NG tube is coming like that and then coiled back again. Just a minute. The coiled back again. It means it is not going to pass further, right? It is not going to pass further. It is coiled and it is going back. Okay, as it is coiled, it is going back. Now, as it is coiled and going back again, what do you guys can understand the making this a diagnosis? So the options are given to you here. The option is given to you: the anterior deviation of trachea, B, posterior deviation of esophagus, C, anterior deviation of tracheoesophageal septum, and the D is given to you: the posterior deviation of the your tracheoesophageal septum. Now, try to answer me in the chat box. I'm waiting for your answer, guys. I'm waiting for your answers. This is a very good question they asked you with the image of the radiological image, right? From the radiological image. Very important. Guys, the first option cannot be the possible, as I can show you the clearly. By this, as they're saying, there is appearing the saliva is there, right? So there is a no anterior deviation of the trachea is not going to seen over there. The air is going good, right? The second, the posterior division of esophagus is totally possible, can be the answer, all right, can be the answer. And the next, the anterior division of the tracheoesophageal septum is also the not seems to be possible over there, because if the anterior lead will be going to make it, so this saliva which is pouring over there, right? This saliva can be go to the, or maybe some the respiratory symptoms can be shown over here, right? So guys, please understand this, and after seeing this image, the making this diagnosis of it, that there is a patient is having, this child is a newborn is having the posterior deviation of the tracheoesophageal septum. What is having this child? The child is having the posterior deviation of the tracheoesophageal septum. Now, if we are talking about this, that what is this your posterior deviation of the tracheoesophageal, right? So just listen this part, right? So just listen this part. Guys, I'm waiting for your answers. When I'm show you the questions, please try to reply, okay? Please try to reply. I want to check your knowledge, right? If you are not replying here, maybe you can make the some mistakes in the exam, right? And I don't want that you guys go and make mistakes in the exams. If you want to make the try, if you want to make the mistakes, you can make mistakes over here, so I can correct you here, right? We have the chances that I can correct you here, right? That this is no, this is not, this is the correct. But if you are going to make the mistake in the exam, that will be not good. That will be not good. Okay, guys, let's move forward. So what is the mean of this posterior deviation of the esophageal septum? Please understand this part. This is the your causing the completely separation of the esophagus. Please understand this part, that this is the posterior division of the tracheoesophageal. It means the trachea and esophageal septum, which is the causing the incomplete separation of the esophagus from the laryngotracheal tube, and that's why this is the resulting in the tracheoesophageal fistula, which is known as the TEF. And then there is due to this there is an incomplete, due to this there is an incomplete formation of the esophagus. Now as the esophagus is incomplete, so what, as the intern to pass this a nasogastric tube inside. So this gone through inside, and as it is packed over there, so this is going back again to it. So if you want to see over here, just I'm showing you with the image of it. Just a minute. I'm going to show you an image of it so you guys can understand the situation, that why this can be happen and how it can be happen. Just a minute. Now you can see over here. Just I'm zooming in with this image. Now you can see over there what is the normal anatomy of over this. Normal anatomy, the esophagus is passing through like this and the trachea is passing through like this. Now due to this, there is a your posterior part of it. Now what can be happen? Your esophagus is blunt. So now what can be happen? This can be seen in this your esophageal ataxia. That what happened with this? That this esophagus NG tube is come like that and coiled back and gone back. Understood this? Right? So this is gone back like this. Is it clear, guys? So that's why, and also it can be seen to you in the cases of it, right? There is a your atresia of esophagus, and maybe this esophagus this attached with the your trachea with the your distal fistula, which is your tracheoesophageal fistula, TEF. Yes, we are talking about this condition. So there is a tracheoesophageal fistula can be seen, right? So this is the image. I hope now you can understand over it. I hope your doubt is clear now, right? I hope your doubt is now clear that this one is your posterior deviation of, yes, posterior deviation of your, yes, posterior deviation of the your esophageal tracheobronchial tracheoesophageal fistula. Clear? Now, next question. Guys, the next question is in front of your screens. I'm waiting for your answers in the chat box. All are the important radiological MCQs are over there. Please try to reply. The image is shown to you a 45-year male with the epigastric pain. With increasing after the meal, the patient is having hyperglycemia. The patient is having what? The patient is having the hyperglycemia. Also, not only the hyperglycemia, the patient is having this steatoria. What is the meaning of steatoria, guys? The patient is having what? A fatty stool, right? Steatoria, right? A fat in stool, steatoria is seen over there. And the done investigation below is given, and they are asking you that this particular is what, right? So, what is this image? Or they are asking you which investigation is done. Please think twice, doctor. You are replying it's good, but try to think why it is, as you answered the MRCP, why the MRCP and how it is differentiated with the ERCP and MRCP. If you know about it, you can identify this answer very well. Just try to answer. I'm waiting for your replies, guys. I'm waiting for your replies. Very good, doctors. Think again. If you are replying by the seeing this image, MRCP and ERCP, the two answers can be the possible, right? Okay, very good. So what is the answer over here, guys? Your answer should be here, your ERCP. right? So who guys are answering the MRCP? That is not the correct. That is not the correct. This is the your ERCP. If I'm talking about this, why this is the ERCP? Guys, please understand this part, that this is the your endoscopic retrograde choleo angio pancreatography. Okay, and this is the endoscopic procedure. It means we have to send this endoscope inside it, and you can see over in this image as I marked over it, this is the endoscopic pipe which is passing through it, right? This is the endoscopically pipe which is passing through it. So this is the particularly, by seeing over it only, we have to identify that it is your ERCP. That is your ERCP. And please remember about it, this procedure is used to identify the presence of a stone, right? A stone in the gallbladder, right? Tumors, and the narrowing in the biliary tract or the pancreatic ducts. We are using this ERCP. Is it clear, guys? So this is a radiological procedure again, right? And yes, we can do MRCP for the CBD stone. Yes, we can do. Okay. Now, moving forward for the next image is clearly seen to you, and we had covered over there, but we didn't ask about the. We saw this particularly image, but we didn't talk about that. What kind of investigation is this? Okay. So let's talk about this also. A female child was found having the dribbling incontinence. Was done investigation shown the below, and the following image is going to seen in this technique. So what is the scene? That we can see the calcareal system and the ureter system also. We guys can see over here, and again there is the seams of the this particularly patient with the dropping lily sign, as we talked about, is the duplication of the your calculator system, as we talked about it. Now, but the question is not asking about the making the diagnosis. The question is asking you that which type of investigation is it. Okay, so investigation is which investigation is it, the question is asking you. I'm waiting for your answers, guys. Please try to reply in the chat box. I'm waiting for your answers. Very good. Some of you are going right. You are getting right this answer. Some of you are saying pelvic X-ray. Okay, doctor. This is the, of course, the X-ray image as you are seeing this, but it is not the plain pelvic X-ray, right? It is not the plain pelvic X-ray. Not possible. The pelvic X-ray is the answer. Okay. Very good, doctors. So what should be your answer? Your answer should be here your intravenous pyelogram, right? So what is the mean of it? Your an intravenous pyelogram. Now listen this part. In the IVP imaging, the stas is used particularly for the kidneys and the ureter. When we want to see the kidney, we have to inject the intravenously. We have to inject the dye, and we have to take the X-ray of the pelvic. This is known as your intravenous pyelogram. Now, the ureter are the narrow tubes, so they carry the urine, and it's the as it is carrying the dye from the your kidneys. So the your calcareal system of the kidneys and the ureters and till the bladder, as it is going to take. So this will be going to drop this total all the dye into the bladder also. So this is the your intravenous pyelogram. Yes, doctor, you are correct. This is the intravenous pyelogram. Very good, doctors. Right. So just remember about it. In which conditions we are doing when we want to see the kidney, right? When we want to see the kidney, or maybe the ureters, right? Maybe there is a duplication of ureter can be the possible. Yes, double ureter can be possible over there. So in such condition, we are doing the intravenous pyelogram. Intravenous pyelogram. Let's move forward. Let's talk about it. A female came to hospital with a complaint of breast lump. Now, there is a history have found of Leaf-Manning syndrome in her mother. What can be the screening test can be used in this case? So we are using for the screening. Guys, please again understand this part. Understand this part. We are talking about the screening. There is a different type of uh, tests are available, right? So we have to talk about the screening test. Okay, the screening as they are asking, so we have to go with the screening test only, not the diagnostic test. I'm waiting for your answers, guys. Very good. Okay, many of you are replying the USG. Some of are replying FNAC. FNAC of the lump, guys. Please don't go with the FNAC in the starting over only. Maybe if it is a uh, your carcinoma, right? And it can be start the bleeding over it after the FNAC. So we cannot do the FNAC directly without the seeing over it, like which kind of lesion is it? Okay, benign. Maybe it's benign, right? If it is benign, we can go for the FNAC. But if it is not the benign, then it is not possible to do the FNAC. What about the USG? Many of you are answering the USG. Guys, if the USG is the screening test, is the USG is the screening test? Now listen this part. For the breast lump, we can do the USG, but on the USG just you can find out that there is a lump is there or not. But by the patient, we can do this lump is there or not by the examination of it. Understood? So for this particularly, for this particularly female, which is already that given history that her mother had this found this history, right? And a complaint is over there. We have to see the your this we have to see the totally the location of your this lump is starting and how it is growing. For understanding this screening, we can do this MRI. Also, for the making the confirmation and the later part for the making the diagnosis of it, we can go with the mammography also, right? But in this condition, we are going with the for the screening test. We are going because the syndrome is a totally we got the patient has had this a syndrome. Okay, yes, yes, very good. Mammographies we have to see for the age. Very good, doctor. Mammography for the more than 40 year of age. Yes, in the later part of age, in the later. Now there is a no age is given. Exactly. Right? We will go for the MRI. USG is okay. I can understand you can say the sir, the initially we can start with the USG, but the USG cannot identify you the type of the lesion is it. Just it will give you that there is a lesion is present or not. Or this breast lump is present or not. But this breast lump, the patient is saying you, the doctor can even by the doing the palpation or by the examination, by the touching of it, the female doctor or the gynae can give you this history that there is a lump or not. Okay, but for the screening of it, yes, for the making the screening of it, we'll go with the your MRI. And yes, will not go with your mammography in the starting only. If there is a needed later, we can do it, but we'll start with the MRI only. So the answer which is making you confusion with the MRI and the mammography, so this is clearing you by the age because the age is not given over there. Of course, is the answer will be the MRI, right? And about the USG, please understand the USG cannot identify the which type of lesion is over there. Okay, I hope you understand about it, right? Very good. Now, moving forward for it, and the question is in front of you that a patient was brought to the emergency with the history of road traffic accident. RTA, and the patient was under the influence of alcohol, was suspected of rupture of the bladder. Bladder is ruptured. Now, the question is going to ask you, what is the diagnostic? Please understand this part. Now we talked about the diagnostic. We are not talking about the screening. I'm not talking about the screening. I'm talking about the diagnostic, that I should going to confirm it. Yes, there is a rupture of bladder is have or not. So now reply me in the chat box that what should be your confirmatory diagnostic for this bladder rupture. I'm waiting for your answers, guys, in the chat box. Such kind of questions can ask you on the 26th, right? On the 20th, on the upcoming 26th, right? Now they are, if they can ask you they are asking you the diagnostic of choice, that confirm by the doing one test only we can make the diagnostic that is the rupture or not, because there is a suspicion was there that rupture of bladder is there. Very good, doctor. USG is not the diagnostic, doctor. USG can be the screening of the bladder, but maybe the bladder is full or not, right? And the USG you can see the bladder when, I hope whenever you went to the doctor, the patient for the USG, the doctor is saying to you that if there is bladder is full, right? After the bladder full, we can do the your ultrasound, right? Before the doing the your ultrasound, the bladder full is needed over there, right? But if there is a rupture of bladder, I don't think so. The bladder is full over there, right, doctor? So the USG can not be give the diagnostic, okay, right? Okay. So the answer of is here is your cystogram. So answer for here is the cystogram. And now your doubt is what is the cystogram? Please remember about it. The cystography. Cysto it means the bladder only. Okay. The cystography is the imaging test of the bladder. And these are the, please remember, this is your diagnostic test. The cystogram, whenever we have any bladder for the making the diagnosis of the bladder, maybe the bladder is stone, we'll do the cystogram. Maybe the bladder cancer will do the cystogram, right? We can do the cystogram for the bladder disease. So I hope now you can remember about it. For the any urinary bladder disease is given to you and they are asking you the diagnostic test, right? Diagnostic, they want to make the diagnosis of that particular patient. So you should answer, you should answer the, your answer should be that is the cystogram, okay, or the cystography. Yes, cystography and cystogram the same only, okay. I hope is it understandable for you guys, right? Now remember about it, okay. Let's move forward. Let's move forward, guys. Who guys are watching live, they should answer in the live chat only, right? If you are replying wrong, so you should understand that why it is wrong, okay. So you will not going to make the same mistake later, okay. Please try to answer, please try to answer, okay. Moving forward, the next MCQ is in front of your screen. A menopausal female found to have a multiple pathological fractures on X-ray. So X-ray is done, all right. X-ray is already done. The question only they make about it. So your first option B is ruled out, I hope, if X-ray is already done, right. The next, what is the best radiological investigation is used to diagnose the osteoporosis? I hope you studied about it, that in the female, right? In the female, there is your hormones. The female hormones are very protective for the female, and after the menopause, there is a absence of your hormones, and due to this, there is a most common problem which is the seen over here. That is your osteoporosis. All right, osteoporosis. Right after the menopause, there is a low calcium, so there is a osteoporosis will be going to seen over there. Now, the option is asking you already on the, we cannot see the osteoporosis on the your x-ray only, right? It is not even clear, right, for the making the diagnosis of it. Of course, there is a multiple fracture which is seen over there. So by this guessing this multiple fracture, we can say that it can be the osteoporosis. But for the making the diagnosis, we have to do a special test, of course. Now, it cannot be the D also. The D is ruled out. Why the D is ruled out? Because all of the above cannot be the possible, and we are not ready to do this. Do this all the tests, then we're going to make the diagnosis of that particular person, right? It cannot be possible, right? It will be too much costly for the patient, and we doctors are trying to go with the one particular selected test that is giving the surety and the surety and the, we can say, the confirmatory diagnosis. All right. So yes, doctors, very good. You replied very well that there will, in this condition of osteoporosis, we should go with the your DEXA scan. We're going to go with the your DEXA scan. And now, what is a DEXA scan? If I'm talking about this DEXA scan, please understand about it. For the getting the bone density, right? For the understanding the bone density, we have to do the scanning of the bones. That is known as your DEXA scan, is also known as the bone density scan. Okay, so the DEXA scan is also known as the bone density scan. And please understand, this help to work out your risk of breaking bone, and they have often used to diagnosis bone related health problems, maybe the bone tumors also. We can do the DEXA scan. If there is a bone densities, we have to check the density of the bone. So like osteoporosis, in the osteoporosis also we can do. Also we can do the some bone cancers also. The DEXA scan we can do with the bone cancers also. So this is the particularly, now I hope you understand, related to the bone disease. If the density related to the bone density test we have to do, so we can go with the DEXA scan. So now if they ask you some parathyroidal hormone, like they given you the patient is from the parathyroid hormone and the patient is having a fracture over there. So maybe due to this parathyroid, now there is a osteoporosis, right? So DEXA scan, again the DEXA scan is the possible answer. Very good. The clearly is given to you that what the best radiological investigation used in the patient with the HLA-B27 positive. Now tell me, what do you guys are thinking over here? Like what can be the answer in this condition? What can be seen in this condition? Which diagnostic test you will be going to prefer in this condition? The question is mentioned over there. The patient is having the HLA-B27. I hope you know about the now this HLA-B27 from their pathology knowledge, right? Right, anterior uveitis, ankylosing spondylitis, right? None of the above. Doctor, you are replying none of the above. But radiological investigation, we already asked the radiological, best radiological investigation. So there is a no possibility of your answer about this, right? So just rule out this. If they are asking you, the question is only asking you the radiological investigation, best radiological investigation, okay? Right? So yes, the if they're asking you best, you should answer the best, okay? You should have to answer the best one. Out of this three, the X-ray is given to you, MRI and the CT scan. This three can be they ask you just only, right? So out of this, what can be the answers? Very good, guys. X-ray cannot give you the about it the clarification, and we should have to do for the MRI for this case. And for this HLA-B27 positive, I hope you remember about it, ankylosing spondylitis. The case of the your ankylosing spondylitis, right? Very good, doctor. HLA-B27. Okay. Anterior uveitis is also in the ophthalmology. If we are talking about it, anterior uveitis is also. Now, moving forward for the next question. The next question is in front of you. Very important question and very confusing. Very confusing. The examiner is try to confuse the students by giving such MCQs. By giving such MCQs. Try to identify, guys. Also, we can say it's easy also. Like, what is given in the question? Now, listen this part. A 45-year-old male presented with a diffuse abdominal pain, right? Shallow breathing, on palpitation, rigidity, guarding over all the abdomen present. There was done an erect abdominal X-ray, shows the following picture of the diagnosis. Now, what can be your diagnosis, guys? What can be your diagnosis, guys, in this condition? Some of you replying B. Guys, I don't think so. Something is seen to you in the chest. The chest is seems almost clear, right? Chest is seems almost clear. Whatever you can see over here, this and this. Yes, whatever you can see over there, it's this. Now, please understand this part. The patient is having is the abdominal pain will be going to seen over the pneumothorax. Not possible in the pneumothorax. There will be the your yes, there will be the abdominal pain will be not seen. Diffuse abdominal pain will be not over the scene. This is the rule out. First of all, the second hilar lymphadenopathy. We cannot see the hilar lymphadenopathy will be also the possible. Yes, hilar lymphadenopathy is also not possible over here. Two things are ruled out. Now we are confusing with the acute gastritis, and the second is the gas under the diaphragm. Of course, it can be the same symptom of the abdominal pain and all on the palpitation, rigidity and all in the acute gastritis, but on the X-ray, this particularly, which is the gas bubbles are seen under the diaphragm. It is the not possible, right? So what is the diagnosis in this particular image? That there is a gas under the diaphragm. Now, if I'm talking about this gas under the diaphragm, please understand this part. How it is possible? Please understand. The acute abdominal pain was by the gas under the diaphragm, which is known as, guys, your pneumoperitoneum. As is the peritoneum layer is over there, and if air is trapped in the peritoneum, that is known as your pneumoperitoneum. Yes, yes, can be seen in the perforation also. Agree with you. Can be seen. Can be seen. Okay. Very good. Gas bubble. Okay. Under the diaphragm. Now, not only this, in the medical emergency, pneumoperitoneum is a medical emergency which is required the urgent evaluation and the management. In the pneumoperitoneum, there is a free air in the peritoneal cavity. Now, there is a free air is in the peritoneal cavity, and it is diagnosed by the erect X-ray or the chest or the abdomen. So, mostly we are doing the whole, the chest and abdominal X-ray. So, we are getting with this particular pneumoperitoneum. Very good. Yes, perforation, also intestinal perforation also can be cause the gas under the diaphragm. Yes, or maybe this also this will be going to go into the pneumoperitoneum as is the pneumoperitoneum. Okay, very good, doctor. Moving forward for the next MCQ in front of you. You guys are going good. You guys are going very good, right? Just be the same confident level in the exam also. Okay, you are guys going very good. Now, a 55-year male suspected underwent given investigation below. The name of investigation they are asking you. Very easy. I hope you can see of it. What it can be. The investigation through this gone. What it can be. Hmm. Very good. Very good, doctor. As you saw, a Doppler of heart. Can you understand? USG of heart. The options are given the confusion, right? This echo only, guys. This is known as the echo only. So what we are getting in the 2D echo, right? 2D echo, 3D echo. So this echo, yes, the same it is used as the, we can say the USG of heart also, or we can say the Doppler of heart also. But the same time, what can be happen by the echocardiography, right? We can say this echo. This is the echocardiography. What we are getting, we are getting this. Yes, of course, this Doppler coloration will be of course going to see because we have to see the filling of the atrium and the ventricles, right? The Doppler, the same probe we are going to use, the same ultrasound machine we are going to use. Yes, but we cannot say that the Doppler of what we are saying it as a investigation, right? We are saying as a name of investigation which is known as echo, right? Echocardiography. So answer should be here your echo, and I hope you know about it. There is a cardiac Doppler ultrasound is visual image which is formed with the technique is known as echocardiogram. So that's why we are sometimes we are saying the cardiac echo, or we can say the echocardiogram, and in the simply we are saying the echo, right? 2D echo. Okay, 2D echo. Clear? So this is the your particularly. Yes, if they are asking you the name of investigation, you should name the investigation. Okay. Yes, and if you are thinking about it, sir, what kind of this question is there? Yes, they are asking you such question. They are asking you such question. Most of the student are, some of them marking the, of course it is ultrasound of heart only, some of are answering the ultrasound, some of this identifying with this color red and blue, they are thinking there's a Doppler, so they are answering the Doppler, right? They are not thinking that it is the echo, that is known as the, also known as the echo. Yes, we are doing the ultrasound of the heart, we are doing the Doppler ultrasound of the heart only, and that is echo. Okay, right? So we can say like cringy question, right? Little bit cringy, right? ये क्या हो गया है ना? Sometimes they are asking such questions, such questions. Okay, let's move forward, right? Let's move forward and moving with the next question in front of me. Now, this is a question which is on your screens. Why you guys have to confuse? Why you have the confusion? They are just trying to make you confused. Don't be confused. Just understand the thing. Whatever they are asking, the suitable option should you have to go. Okay? With the suitable option you have to go. Now, which of the following correctly explained the given image? And the image is given to you, and the options are given to you. The option A is the single bubble sign, option B is the gas in the abdomen, option C is the multiple air fluid levels. Guys, please understand this part, air fluid levels they are asking, and the D is they are asking none of the above. Now try to understand. Guys, the rule out the first thing, don't reply about the A. The single bubble sign is not over there. You can see there is a not a single bubble. Okay, the single bubble sign I shown you, only the single bubble will be going to seen in the abdominal X-ray. Only the single, only the one. Okay, not never ever going to possible option A. Okay, very good doctors, very good. So the option A is ruled out. It cannot be possible. Let's remove it. Option D, none of the was never ever possible. Now we have the two options. The one, gas in abdomen. The option C, which is the multiple air fluid levels. Air fluid level is means what, guys? There is air also and the fluid also. The both of are available over there. Okay, that is known as the air fluid levels. Very good, doctor. Yes, good, good doctors. Please understand this part. There are the multiple bubbles you can see over here, right? How it can be the single bubble. Okay, there's a multiple, and also as it is a multiple bubble, so of course it should be your multiple air fluid filled levels. And guys, if I'm talking about this multiple fluid levels, now understand this part, how it will be going to seen on the plane x-ray. It particularly you're on plane x-ray of the abdomen in the erect posture. If we found the multiple air fluid filled levels in the central abdomen. And now please understand this part, the relatively with this the relatively paucity of the bowel gas distally. And please understanding this part, for this making this a multiple bubble, this are giving us the confirming diagnosis of the intestinal obstruction. Okay, I'm not talking about the perforation again. Please understand this part, right? We are talking about what? Guys, fluid you are talking about it, doctor, as whatever I'm drinking, whatever I'm eating, this all fluid is going inside the intestine or not? Tell me, whatever I am having, this all going through the intestine or not? Tell me, if you are asking the fluid is coming in the, how it is possible, right? You are asking that how it's possible that fluid is inside the this, right? Yes, doctor. If intestinal obstruction is over there, how is it possible this all the fluid is going to pass? Whatever you have drank, okay, as I drinking this water, right, it will be also going through this pass through intestines, and air is also trapped because of the intestinal obstruction. So there is a different on the different area there will be the scene, there will be going to see the intestinal obstructions. Okay, clear, doctors? Is it clear, doctors? Very good. Okay, good. Let's move forward. Yes, so answer should be here your multiple bubble which is the fluid filled. Okay, now the question is a very classical picture, and they are giving you the hints also. Now the patient was brought to the hospital after the RTA. Please try to first of all understand the things that whenever you see the MCQ, please try to find the keywords. What is the meaning of keyword which can help you to identify the making a diagnosis of it, or maybe it can help you to get to the answer. Also, as the RT is done, the patient is conscious, and BP is the blood pressure is 90 by 70 mmHg. I hope you can understand it is a decrease, or it we can say the low, in the hypo we can say. And X-ray revealed the following. What is the diagnosis they are asking? Now tell me, what is your diagnosis? The options are given to you: hemothorax, the option B is given to you with the pneumothorax, option C is given to you the right pleural effusion, and option D is given to you the none of the above. Try to understand, guys, try to understand why. First of all, you should understand, first you should, yes, you should understand why this answer. Okay, the clearly the words, the keywords I already highlighted. Now first of all we'll rule out the pneumothorax. Why this is not the possible pneumothorax? You can see over there the both of the lungs are clearly visible on the x-ray. If there is a pneumothorax, the lungs will be the coiled on the shaft of it, and there will be the dark black color shadow will be seen over here, but it is not possible. So there is a no. First of all, there is a no pneumothorax. Understood? Pneumothorax is ruled out. None of the above is not over the possible. Leave it. Now you can see over here the trachea is also diverted on the right side, and on the left side, right side, I can see this CP angle. Yes, you know about it, the CP angle. Yes, you know about the CP angle, cost of angle. right? Costophrenic angle. Costo, it means your ribs. Phrenic is your diaphragm. So this diaphragm and this all are making your angle over here. So this the CP angle is seen on your right side. This is the right side. What about the left side? As I'm seeing on the left side, this CP angle is blunt. It means some fluid is going to accumulated over there. The CP angle is, yes, the left side. Yes, very good, doctor. You identified very well. On the left side, the CP angle is blunt. As the CP angle is blunt, that can be seen. Yes, of course, it can be seen in the pleural effusion also. It can be seen in any fluid accumulation like pneumothorax also. But why? First of all, it cannot be the pleural effusion. Now, on sudden, already the patient is mentioned with the RT. So in the road traffic accident, the pneumothorax cannot be going to this pleural effusion will be not going to generated on sudden over it. Also, the blood pressure we are seeing, the blood pressure is getting low, right? As the blood pressure is going to getting low, so what should be your answer? Your answer should be here the hemothorax. Your answer should be the here your pneumo. Yes, the CP angle is blunt. Yes, the CP angle is blunt, doctor. Very good. So the answer is your hemothorax. And what is the mean of hemothorax? By the word only you are understanding hemo, it means the blood. Yes, and this blood will be going to accumulate in the chest. We can say the chest or the thorax cavity. Yes, so this bleeding inside this thorax is your hemothorax. And please remember, it is over here. You can see it is blunting of it. It means this blood is filled on the CP angle is totally blunt by the bleeding over it. By the bleeding over it. Okay. Clear? Is it clear, guys? Very good. Let's move forward. Now, we are moving forward with the next MCQ. This hemothorax is the collection of the blood in the space between your visceral and the parietal pleura, which is the known as your pleural space. Let's move forward. And I hope this picture is the, I hope you remember this picture. Just we talked in this about this particular image in the uh, top image as we covered over there, right? Or the important images we covered over there. So I hope you saw this image. But there's a totally the in the question they are asking, not asking you the identifying the or the making the diagnosis of it. They're asking you the risk factor. But before they're going to the risk factor, I am asking you, what is your diagnosis and which sign over going to see over here? Just tell me. First of all, try to reply me what kind of sign you are seeing in this particular image, and then we'll go for the first of all, which kind of this image? CT, X-ray, MRI, USG. What is this? Guys, don't answer the first atherosclerosis, atherosclerosis. It's okay. I understood. First of all, what time I'm going to ask you, just try to reply me that. Just try to reply me that. Which sign is seen on this particular image? Sorry for it. Sorry. Try to reply me. Very good. It is a CT, right? Okay. Which sign is seen in on this CT image? What you can see? Very good, doctor. Very good. As you saw this, just tell me the name of sign. You you reach on the diagnosis. Very good. You reach on the diagnosis. Very good. Very good, doctor. You can see over here, this is the aorta and there is a tennis ball. I hope you understand now. Yes, there is a tennis ball sign. Okay, this is the tennis ball sign. And on which disease it will be going to seen over there, guys? Try to reply. The tennis ball is seen in which? Tennis ball is seen in which condition? I hope now you reach on the diagnosis. Now you guys will be going to reach on the diagnosis. Yes, aortic dissection. Very good. Now come to the MCQ. So what is this asking? So what they want to do, they want to go through this image to make the diagnosis. If you understand the diagnosis, now you can answer this. Now tell me, what is the most common risk factor of the aortic dissection? Is the atherosclerosis, B is the diabetes mellitus, and C is your hypertension. The D is the none of above. I think it is not the possible answer for you. So just try to reply me about this out of this three. Just try to reply me. I'm waiting for your answers, guys. Just try to reply me. What can be the possible? I hope if you studied about the aortic dissection, the most common risk factor you studied. Atherosclerosis is not the most common, doctors. Atherosclerosis is not the most common. Very good. Come to the part of it and please try to understand. The answer is your hypertension. Yes, the diabetes is not the possible. Only the two options, atherosclerosis and your hypertension is can be the answer over here, right? Related to the vessels, if I'm talking about it. But guys, please try to understand this thing. Please try to understand this thing. In the atherosclerosis, the your arteries will be getting harder. Am I right? The arteries is getting harder, or maybe there is a sclerosis. There's accumulation of plague over there, right? But is it something is happening in this aorta? It is atherosclerosis will be going to affect your greater arteries. No, in the smaller arteries, the atherosclerosis can be affected over there, right? Like if I'm talking about the coronary artery disease, of course there will be the answer should be the atherosclerosis, right? Now, please understand this part, okay? Now, so the most common, if I'm talking about the risk factor of your artery dissection, so your answer should be your hypertension only, right? It is seen in the hypertensive patients, in the hypertensive patient, okay? So the most common is your hypertension, hypertension, okay? Let's move forward for the next MCQ, which is in front of you. Just try to reply. A patient with the right hypochondrium. Guys, I hope you know about the all the 9 region of abdomen. Sorry for this, right? I'm not well, guys. Sorry for this disturbance. Very good. So the answer is here asking you about from the identifying the image which is given to you and trying to ask you about the making the diagnosis of it. Okay, very good. As they given you the particularly the diagnosis. So first of all, try to make the diagnosis. Try to make the diagnosis. The patient with the pain in the right hypochondrium since 3 days underwent to the USG. Reveal the picture. Picture you can see over here. Very good, doctor. You made the diagnosis. You make the diagnosis. Okay. Uh, Doctor, you are answering the first of all the like to be renal calculi. It's not the possible, right? In the right hypochondrium, it's not the possible, right? In the lumbar regions can be the possible. Okay, hypochondrium, never ever possible. Okay, the first of all, so rule out this. Okay, indicate none of the given above options, not over the possible. Now, out of these two, there is the indicate the posterior acoustic enhancement, and the second option is given the acoustic shadow. Guys, what you guys can see over here, this is the something is over here, and due to this, there is the acoustic shadow. You can see this is the shadow which is seen over here. This, due to this, there is a shadow is over there, right? How we can talking about the your shadow? If I'm talking about it, if I hold this pen in front of the light, so this pen will be going to make the shadow over this shadow on the posteriorly, like if I'm holding any space, right? So if there is a something that will be going to make the shadow over it. the first of all. So now by the seeing this ultrasound image, you can tell me there is a shadow or enhancement, right? Enhancement, it means the light is going to increase over there. That is known as enhancement. But it is not over going to see. I don't think that it is going to show you the enhancement of this, the enhancement of your this acoustic, right? There is a no acoustic enhancement. Yes, there is a acoustic shadow over there. And please remember, yes, so this is the stone in gallbladder, which is your cholelithiasis. By the seeing this ultrasound image, you can find out due to this acoustic shadow, yes, due to this acoustic shadow, you can identify that there is a gallbladder stone, which is known as your cholelithiasis, which is also known as your cholelithiasis. Right, guys? Is it clear? I hope is it clear to you? Okay, we'll talk about, I will going to show you the acoustic enhancement also. Just wait for it. I'm going to cover up this acoustic enhancement also. I'm going to show you the ultrasound of acoustic enhancement and acoustic shadow, both of it. Both of it I'm going to show you. Just wait for it. Or just once go through it first if you are talking about it. So let's talk about the ultrasound. As I showed you, I hope you saw this. I hope you had gone through this ultrasound, or maybe you saw this in your hospitals, right? When you went to the hospital. So this is your ultrasound machine, or we can say the USG machine. And in this machine, we have the first of all here the monitor, from where you're going to see this the visuals which we are getting over there, and there will be the controllers. Here will be the controller. This is the controllers, and also we have over here this different probes. What we have? We have the different probe, and this is the area of probe connector. What is this with good with the probe connector? Please understand this part. Uh, which brand machine is over there? They have the different probes over there. So the same machine or the same comfortable or the compatible probe will be going to attach with the machine only. It's not like that from any other older machine the probes can be attached to the new generation of the machine. Never ever possible. Okay, so we have to use the probe from the same, maybe from this, we cannot say the same brand, I'm not saying to you, but the compatible, okay, which is the compatible over there. And there is a very different type of probe. I hope you can see this big one probe, which is the long one probe. I hope you can see over here, right? This is a long one probe. This is a transvaginal probe, TV probe we are saying. Yes, this is a transvaginal, right? So this is a transvaginal probe. Also, we have the different probes as we have to talk about this. So you can see over here, this is the linear probe. It means it will be going to in a line format, right? In a line, it means they will going to give the acoustic, this sonic waves we can say over there in the only in the linear form. But also we have the curvilinear, right? It means the curve. You can see over there, we can see this is the curvature one, and it will be going to give the sound in the curvature form. It's like that. It is going to give like that. Okay. And you can see there is a phased array, which is the small one, right? It will be going to give the also in the straight formation, which is in the phases. In the phases, it will be going to give. Now you can see over here. You can see by this which probe is over there. I hope you can identify. This is your circular probe, right? You can see this is the circular probe, and this is also the your circular probe. I hope now you can see understanding. The circular is giving like this. The linear should be given in the linear formation like this, straight. Okay, that will be in the linear. And if it is going like this, it means it is a circular. Okay, it is from by this probe. I hope now you understand this thing, right, guys? I hope you are understanding. Now you can see in the both of this image, there is a two image are given over there: acoustic shadow and acoustic enhancement, as we talked about it. So now you can see over here in this image that this is the after the passing through it, there is a shadow over there the scene. So this is known as your particularly acoustic shadow. As we are talking about the enhancement, so you can see over here, so that this is the lesion, and after this lesion you can see there is a bright white color. Enhancement is seen to you. So this is known as your acoustic enhancement, right? So I hope now you can understand over there, right? So in the stones we can see the uh, shadows, right? And in the cystic lesions we can see over the enhancement can be seen. Okay, acoustic enhancement can be seen in the cyst, right? So this is about the basic of the USG, right? Which is the base of USG. I just told you over there. Okay, so we told about it and we talked about that particular one, right? This is the calculi in the gallbladder, which is cause the pronounced posterior acoustic shadow, which is going to cause your posterior acoustic shadow. Perfect. Let's move forward. Let's move forward. If you understand this, right, we are moving forward for the next MCQ, which is in front of you. And I hope you know very well if you studied medicine subject, right, or the surgery also. I think in the surgery also you have covered this particular disease. So in front of you, and just first of all tell me before the making a diagnosis of it, like which investigation is it? First tell me which investigation is it? Yes, of course, it is clearly written in the MCQ only. The esophagus, which is seen on the your barium swallow. Okay, so we given the patient the barium, and the image is shown below. What kind of? Okay, what kind of the diagnosis is there? Please try to answer. I will going to talk about this all of it, and please answer the sign which you are going to see over it. Which sign you are seeing over it? Any special named sign? Yes, this is a barium swallow. Very good. Already the question is mentioned, right? But which sign is it? Can you tell me the name of the sign? Very good, doctor. You answered very well. You are going good, right? You are going good. Very good. You all are going good. Let's talk about it. The options are clearly given to you, that diffuse esophageal spasm, esophageal carcinoma, esophageal ulcers, and achalasia cardia. So for the ruling out from the starting, we are starting from the lower side. In the achalasia cardia, guys, tell me which sign will be going to seen in the achalasia cardia. I'm waiting for your answers. Let's rule out all of it. Let's rule out first, right? Tell me which sign will be going to seen in the achalasia cardia. We talked about in the previous images. I hope you know. I hope you remember about it. Just tell me in the achalasia cardia which. Tell me fast in the achalasia cardia which sign will be going to seen. Very good. Bird beak appearance. Very good. Now tell me what about the esophageal carcinoma? Tell me what is in the scene in the esophageal carcinoma? Just I told you, doctors. Just I'm going to show you again the images, so you guys will be not going to confuse in the exam. Okay. See, this is the bird beak appearance, which is seen in the achalasia cardia. Yes, which is seen in the achalasia cardia. The second one, which we are talking about, the esophageal carcinoma. In the esophageal carcinoma, just now I told you the rat tail appearance. Yes, the rat tail appearance. Yes, can be seen the apple core also. The rat tail apple core is not in the esophagus. That is seen in the apple core is not going to seen in the esophagus, doctor. Don't be confused. Apple core will be not going to seen over there. Okay. The esophageal carcinoma, there will be the your rat tail. Write down, guys, rat tail. Now, moving forward, and the last, which is the esophageal ulcers. Guys, please understand the ulcers will be not giving you such appearance. which is your zigzag appearance. Like if I'm talking about it, it is giving you the appearance of like this. And it seems like that. I hope you saw the corkscrew. Yes, very good. Now you understand colon cancer, apple core appearance. Okay, doctor? Now you are corrected. Now, tell me, it seems like that this is the corkscrew appearance for the opening the your wine, right? I hope you saw that wine opener. Just I'm showing you the wine opener also. So I hope it will be clear to you. Just a minute. For the opening this wine, we have to remove the wine cork, right? I hope you saw the wine is having a cork over it. So for removing this cork, yes. So this is the cork screw. Just a minute. I hope now is it clear, seen clear to you. I hope is it clear to you. Now you can see over here, right? Okay, now this screws. Can you see this last one which is having on the cork screw for the opening the cork of the wine, red wine. Like mostly we are talking about the red wine or white wine. So for opening the cork of this, we have to use this cork screw, right? So that's why this is giving also the cork screw appearance. Can you see this similar? This part of this cork screw is similarly seen on the your barium swallow on the barium swallow. And guys, please remember about it. This is seen in the particularly in your diffused esophageal spasm. Okay, this is seen over in the your diffuse esophageal spasm. Okay, so answer should be your A is only the answer. Very good, doctors. Acute, your this is the your diffuse esophageal spasm. Perfect. Let's move forward. Yes, corkscrew appearance of esophagus seen in the diffuse esophageal spasm. Moving forward for the next MCQ. Very good MCQ, and please try to answer very well. Just see about it. What is they are asking you, and they are little bit making you confused also to get this thing that what is this particularly the image is given to you. Try to reply, identify the image technique which is employed and specifically diagnosed related to the kidneys. First of all, tell me, this is the two type of the diseases they are asking. The one which is that talking about the option A and B is saying the polycystic kidney disease, and option C and D is saying about the horseshoe kidney. So first of all, try to rule out the disease so the option can be ruled out. Okay. Yes, try to rule out. I'm going to show you the image then about this also. Just try to rule out. Is it the polycystic kidney disease or is it the your horseshoe kidney? Of course, it is a your yes. The horseshoe kidney should be fused over there. So you can see over here, I am putting an image of horseshoe kidney for the understanding for your this horseshoe kidney, and you can see over there this both kidneys are attached. Can you see? Can you see this? And this is the horseshoe kidney. So it is not seems like that. So the option C and option D is ruled out. But now my question to you guys. Yes, option C. Doctor, not possible option C. Horseshoe kidney तो मैंने अभी ये image add किया है. Okay. Sorry for it, guys. I just added this horseshoe kidney, doctor. I'm not asking you about this. Okay. Now, tell me, is that clear that this is the polycystic kidney disease? But how you get guys ruled out? Is it the CT of this person from the polycystic kidney disease, or is it the MRI of it? Just try to tell me first of all how you identified this and tell me the what should be the answer. Yes, very good doctors. You answered very well that this is the MRI. This is the MRI of the polycystic kidney disease. I agree with you. But my question to you that how you can identify this is the MRI or the CT. Please understand this thing. On the CT, we are using which rays? We are using the X-rays. And on the X-ray, if I'm talking about the bone is seen. How's the seen in the bone? This on the CT, bone are seen in the white dense. Is it the seen the white? Is the vertebral column is seen to you more whiter, or the cysts are going to see your more whiter, right? You're more this is the if I'm talking about the more white is seen your cyst, right? Very good. That's why, sir, this is the MRI. Very good, doctors. You can see over there. And just I'm adding a CT scan also. Just a minute. So it will be the CT of polycystic kidney disease. So you guys can understand of it by the seeing it, like how it is going to differentiate it. Just a minute. How we are guys going to giving the differentiation between the CT and MRI. So this is the image A, which is the MRI, and this is the you are seeing the image number C. This is the MRI of horseshoe kidney, and just I'm inserting one more image. Just I inserted this, and this is the image. I hope now you tell me which inserted just now. What is this? Yes, what is this? By the seeing this, you can understand that bone is seen the more whiter, and your cysts are here dense. Okay, the cysts are seen the blackish color. Okay, so what is this possible, guys? Of course, as it is a polycystic kidney disease, this should be the image number B, which is the your this is the image B, which is the your CT scan of the polycystic kidney disease. I hope now you guys can understand by the seeing of the images, you can identify also that is the from a CT or is it the MRI, the first of all, right? Also you can identify the diseases by the seeing, although the CT or the MRI, if the cystic lesions are seen over the if the cystic lesions are seen over the, your kidneys, that is the polycystic kidney disease. If they're both of the kidneys are joining together, that is your horseshoe kidney. That is your horseshoe kidney. Is it clear? Is it clear, guys? Any confusion? Any confusion? I think is it clear with all the images, right? So just remember about it. The image A is the MRI of the polycystic kidney disease. MRI, the B is the CT scan of your polycystic kidney disease by the seeing your vertebral column. Just see the vertebral column. Also, you can see the ribs also, right? Whatever the ribs are all seen over in the image number B, you can see this seems whitish, right? The ribs, right? And the vertebral column is also seen totally white, right? Also, over the if I'm talking about the C, how you can identify this thing? Just by the seeing again this image, you can identify that this is the your MRI of the horseshoe kidney. This kidney is this attaching over it. Clear? Or you want to see the image D also, right? Very good, doctor. Okay, if you're asking, we'll go through this also the CT of horseshoe kidney, right? I have the CT of horseshoe kidney. Just a minute. Just a minute, guys. I'm finding this. Just a minute. Yes. Now, you can see over here, I'm inserted image, one more image over here. This one. Now, just for the understanding it, please try to see this and this image. and try to reply me which is the CT and which is the MRI. Just try to reply which is the CT and which is the MRI. Just by the seeing again the easy to understand and easy to remember. Again easy to remember as there is a bone. Now what is the bone? You can see the vertebral column. Just check out the vertebral column. This is the vertebral column. How is it? And how is it shown over here? Just by the seeing over it, you can identify this is the CT. I already marked over here. This is the CT of, I already marked over here, just by mistakenly written there is a C, right? I already marked this, right? This is the your CT of horseshoe kidney. And you can see over here, this is also the attached, but by the seeing your vertebral column. Yes, it is the black. So what is this? This is the MRI of your, yes, this is the your MRI of your horseshoe kidney. Is it clear? This is the MRI of the horseshoe kidney. Yes, clear. Now all the four images are clear. If they are asking you any image, I hope you will be going to understand this thing. Okay, very good. Let's move forward for the next question. Let's move forward for the next question. And this is a clearly MCQ from your radiology. And moreover, this is used in the your oncology also, right? As in the radiation, we are using moreover in the oncology nowadays, right? And in the nuclear medicine, I hope you studied. If you studied the nuclear medicine, this is a very good question. The which tissue is our body is the more sensitive to the radiation? Very good question to you. And many of you are confusing about it and try to changing in the answer. Just try to answer it and reply me in the chat box which is the more sensitive. The option is given to you: the skin, muscle, bone marrow and the nerve tissue. And then we're going to talk about this. What can be the more? Nervous tissues or the bone marrow? Like the muscles cannot be this. Okay, muscles are not the more sensitive, and also the skin is not even more the sensitive. But the bone marrow and the nerve tissue, this is the two options which are making little bit the confusing over it: the bone marrow or the nerve tissue, right? So what can be the your answers? What can be the your answers, guys? What can be the your answers? Is it the nervous tissue? Because nerve tissues are also can be involved the sensitive, or they are not sensitive to the radiation. Very good. Let's talk about it. The answer should be your here, the bone marrow. Why the guys bone marrow? Please understanding this part. If I'm talking about the sensitivity to the radiation, this is always in the new growing cell. Yes, this is always to the more sensitivity to the new growing cell. Okay, very good. Nervous tissue are the radio resistance, right? So the new growing cell. Now tell me out of this, what is the new growing cell? Always, of course, the muscle is also the new growing, but not the so much. Skin is also there, but there is a turnover time of the 56 days. So there is also not the so much nerve, new cells are going. But in the bone marrow, there is a blood cells like RBC, WBC, and the platelets. They are growing. Yes, the blood cells are forming from your bone marrow only. Like if the option is given to you with the bone marrow, like the testis. Okay. So of course in the testis also what is happening? The sperm is there, which is the new growing cell, right? So the testis can be also the radio sensitive organ, right? And but the bone marrow is the more oversensitive because there is a blood cells are going to produce from over there. So that's why if the patient which is going through the radiation therapy, we can see over there the anemia is going to seen over there, right? And we are seeing like there's a radiational anemia. We can say also the or maybe the chronic disease anemia we are seeing, right? So due to this, the patient is going through the anemia, right? Or we can say the there is a the polycyte like the we can say the pancytosis. Okay, so there is a decrease pancytopenia. There is a decreasing of the all the cells, like WBC is also decreases, platelet is also decreases, RBC is also decreases. So your the bone marrow is the more sensitive radiation to the radiation. Okay, please remember about it, and please remember the cells of the bone marrow is the proven highly radiosensitive, which is the your pluripotent cell and pluripotent cell and multipotent cell, right? Pluripotent and multipotent cells, which are the colony forming cells, are over there, which are making this blood cells, right? So these are the your more over the sensitive to the more sensitive to the your radiations, all right? Okay, guys. So we are finishing this session here only, and most of the we covered the all the important images, image based your uh, questions, which is from the radiology they are asking you. And if you guys have any doubt over there, you guys can contact me on my Instagram. The Instagram handle is the Dr. Vaibhav Ahuja. Please remember there is a dot between the D and R in the name and this all. And if you are without the dot writing, this is the my personal Telegram username, right? This is from the Telegram. Okay, so you guys can directly message me or the ping me on the Telegram if you have any doubt. And regarding about this PDF, if you are asking about it, so this will be going to get on the Meduhub channel. You will be going to find in the below the link which is given on the link which is given in the your YouTube link, right? The link is given on the YouTube description, video description, right? So that's it for today, and I hope you had learned very good things from this session, and you will be going to utilize this session for your upcoming FMG exam, right, guys? And that's it for today. And again, I'm wishing you the all the best for the your exams, which is on the 26th, your FMG exam, and best of luck to you, everyone. Give your best. I hope how much you have studied, that is more than enough. And please remember, out of this last days, don't add on the new things. Please don't try to do like whatever you didn't had, and please don't add on the any new things. What kind of, maybe your friend is going to suggest you, I have this kind of the revision or whatever. Just I be gone through the MCQs. Why I didn't given you the such notes or whatever? Just I gone through this, you're revising with the images. Of course, the same images you are having in your notes also, right? So just we are going through this revisions kind of, or I can give you the like buzzwords kind of, the keywords kind of the things, right? So that's it, right? That's it for today. And again, I'm wishing you the best of luck for your examination.